I'm Sharon McDonald. I'm a medical epidemiologist. We've set up the Yarmouth Community Coronavirus Task Force, and this is our inaugural video for all of you. I'm a medical epidemiologist, which means I'm a physician and with specialty training in public health and epidemiology. I've worked for many years in outbreak detection and response, and seeing what was happening here, I felt very strongly that we needed, as a community, to be prepared rather than to wait for other things to happen. The Yarmouth Community Coronavirus Task Force is a grassroots organization that's been started by local people using local organizations. Our goal is to make sure that we maintain continuity of services for government as well as police, emergency, food supply and support, and local services such as for aging and for children as well. At this point, we are starting a call center and trying to make sure that you have the kind of information that you need to manage and as well to know what community services are available to you and for you to know what you need to do as much as you can for yourself. We will be working with town government, police, fire, emergency medical services to make sure that they can maintain their services and that we provide them the kind of support that they need to do their jobs well. That it really include information so that people are using and asking for their services at times that make sense and they can respond to, that they're safe and protected and that you're safe and protected. Emergencies and epidemics are disasters, and this is not only a technical disaster with epidemiology, probably is a word you haven't spent a lot of time saying, but there's psychological and social disasters as well, in which we're all asked to keep to ourselves and try to find our way at a sort of viral distance from each other while keeping our sanity. We hope to make sure that you have the information that you need to make decisions and to feel safe. This is a time of enormous uncertainty, and nobody likes uncertainty. And so we have made sure that there are supports and information to help you sort of think through things. There's an element of psychosocial support. This is our emergency operations center here at the library. There's a call-in number, and it will also be available through a variety of ways. We need to make sure that we can keep providing basic information to you as things change, because things will continue to change almost day by day. As someone said, the last day was the longest month of my life. And we will keep having to make sure that you have information. But as I've been in contact with many of you, I want you to understand that as much as things are changing, they stay the same. You wash your hands, you don't touch your face, you maintain social distance, probably stay home unless you're doing essential services. So it's not rocket science, and it's a little bit disappointing that it's so low tech, but it's what works. And we want Yarmouth to stand out as one of the safest places that really was able to mitigate the epidemic and protect our health workers.